Good morning, everyone. I want to welcome you to another episode of A View from the Hill, and we're continuing our episodes on opiate addiction. If you remember in the last episode from A View from the Hill, we met with Commissioner Monica Burrell, who was talking about opiate addiction at a state level, and she gave us some great information on how people can get help and prevention of opiate addiction and things of that sort. What I wanted to do in today's episode is I actually want to talk about the opiate addiction more at a local level. I was very discouraged recently when I was going through some blogs and some Facebook articles that because of some deaths that had taken place due to opiate addiction, and the feedback that we were getting on these blogs were that we weren't doing anything as a state and we weren't doing anything at the local level. So I'm thrilled today to have Lieutenant Hubbard from the Ipswich Police Department here with us so that we can talk about the opiate addiction issue at a more of a local issue. And then in the second part of our episode today, we also will have a special guest where we will invite the Gloucester Chief of Police to come and talk about this issue as it affects the whole Cape Ann area. So Lieutenant Hubbard, thank you for taking some time out today to come talk about this very, very serious issue. You and I have discussed this issue numerous times in the past, and again, I was sharing my frustration that people out in the community and across the North Shore, they just weren't believing that we were doing anything in regards to this crisis. And I know that that's just not the case. So I wanted to give you an opportunity to come in and talk to the Ipswich citizenry, but this is going to be going out to other North Shore stations as well. Let people know what local police departments, one, are dealing with. First of all, let's talk about the issue itself, but then what we are doing to help people and what we're doing toward the heroin epidemic that currently exists here on the North Shore. So welcome to A View from the Hill. And any opening statements you want to make about the issue itself, and some statistics you might want to share with us.
Well, I appreciate you having us on. Obviously, it's very important for us to be here and to get the message out about what we're doing and how people can help their family members or their friends, because this is a very big issue and it's just getting worse, and we want to make sure we can do everything we can to help, but also people know how they can help their family members. So just some brief numbers. Since 2012, we've responded to 45 overdose calls. Now, that doesn't necessarily mean those were all heroin overdose calls. So people might hear that there was an overdose on the scanner or something, but that doesn't mean it was necessarily an opioid one. Of those 45 since 2012, 8 of them were suicide attempts. So those had nothing to do with, it was just somebody taking a bottle of Advil or something because they were trying to commit suicide. And that's unfortunate in itself. That's another issue. But of those 45, 20 of them were heroin overdoses. So that's almost half. So that's quite a bit, and it's been increasing since 2013. Out of those 20, we've had 8 deaths, and that's since 2010, because we did have one in 2010, and there wasn't one for 2 years, and then there's been 7 since 2012. So that's unfortunate, obviously, and we feel this can be prevented. This isn't something that needs to happen. There's warning signs, as the commissioner was saying earlier, and people need to see those, and we're here to help, and we want to make sure we're not here to arrest people. We're here to make sure they get help, because when you help somebody, they become a productive member of society. Just arresting people doesn't give us that. We want to help them, get them better. As the commissioner was saying earlier, this is a disease. This is a problem that we need to help people with. It's a sickness.
With that said, so I think those are some startling numbers, to be quite frank, and higher than most other North Shore communities, at least the ones that I represent. So of course an alarm goes off when I hear those type of statistics. Give us an example of some of the things now that we are trying to do, not only to help those who may be addicted to opiates, but some of the task forces that you have been part of, the police department, how we are partnering with the state and other local entities to try and address this opiate crisis. Because I think it's important for people to know we're not sitting back. We are reaching out, we are partnering with other agencies across the state and across Cape Ann. What are we doing here in Ipswich?
Well, I think one of the first, we've been doing several things, but one of the things I'll talk about first is we now have nasal Narcan in all the police cruisers, and we also have one up at the booking room. So if somebody comes in that's been arrested and all of a sudden they have they've ingested something prior to the arrest, we can help them in the station. The officers,
explain. I know the commissioner in the last episode talked about Narcan, but let's talk about it again so people understand what it is and the fact that we now, if I'm not mistaken, all our Ipswich police cruisers now have all Narcan in them. So in case there is an overdose, that you can address it. What does it do?
Okay, and it's not just the police department; the fire department as well carries it. This is a collaborative program through Beverly Hospital and the state, and we've been accepted into the program. All our officers have been trained and all the firemen have been trained. The firemen have actually been carrying it for 2 months more than us, and they actually have recorded one save with it. So it shows that it works. The Narcan basically, it works to reverse the opioid. So when you have, it only works for opioid drugs, so anything that's opioid based, that's all it works for. So if someone's overdosing on something else, it won't work. And if somebody's overdosing on something else, or we suspect there's an overdose and we use it, it has no ill effects on someone who is not experiencing an opioid overdose. So there's no ill effects on somebody else. So if we suspect that and we try it and it doesn't work, it might be something else on board that's not opioid based. All the officers receive training yearly. We have an in-house training instructor that works for our department that provides the training, and it's effective it takes effect in 1 to 3 minutes upon delivery, and it basically reverses the opioid, which allows breathing to begin, because the opioids basically stop the respiratory system from working, and that's how the overdose happens. It just shuts down your respiratory system and you stop breathing. So the Narcan actually reverses that and allows the person to start breathing again, and it's effective for 30 to 90 minutes, which is plenty of time to get them to a hospital to get treated with more advanced drugs.
Beautiful.
So
what else is going on?
Well, we're proud of that program, so that's good. But that doesn't prevent it.
Of course.
That just treats the problem, to help people live. So there's other things we have going on. We have a very active DARE program in town, and we're very proud of that because that's something that has kind of fallen by the wayside around the country as the funding dried up. A lot of places stopped doing it, but we feel strongly about that. So the chief has continued to fund that. We have two full-time, two DARE officers that teach the 6th and 7th grades at the middle school. And not only do they teach about drug abuse, prescription drugs, the dangers of them, they try to build self-esteem in the kids, teach them how to make good life decisions, and that comes with texting and this and these other types of things, social media decisions, to try to make sure the kids are getting a good message of being a good person and a good member of society and having the strength to make good decisions. So that's where our DARE program is. And we
now,
really
what age group does that
6th
affect?
and 7th grade. And we're actually looking to expand it maybe even down into the elementary schools or even up into the high school. So we're really focused on making sure the children in the community are learning to make good decisions for themselves. And the officers have gone on field trips with them and different events. They spend time with them. And that we hope that builds a relationship with them, so if they have a problem down the road, they feel comfortable coming and talking to a police officer, because the police officers have been in the school with them, with the SRO in the school, with the elementary schools and the high schools, now with the DARE officers teaching the classes, going on trips with them, and just kind of being a friend to them. So they have trust and they can come. They know they can come to somebody. If it's a friend that they have or a family member, they might be able to come in and say, hey, I know this person has a problem. I need to get them some help, and we're hoping that trust builds up, and we have some good relationships with the kids because of that program.
So let's talk about the DARE program for a second. So this is one of those programs that, as a legislator, you always get bothered when you have to make hard cuts during bad economic times. And this was one of those cuts that we made in the legislature. We used to fund the DARE program to all of the communities across the Commonwealth, but during the bad economic times we had to cut that program. Ipswich, being a leader, and I've been through the DARE program with some of you in the past, it's a great program. How's it funded now? I mean, my understanding is a lot of it's privately funded.
Yep.
And I think people need to know that they can donate, actually, to the DARE program so that we can even enhance it and make it better. Is that an accurate statement?
It's funded through the department's budget. The chief picks up a lot of the budget, absorbs it through our budget, and then we get donations through the community. I know the Rotary sponsored a big portion of the DARE program for the last couple of years, and the individuals in the community donate. We have a separate DARE account that's set up as a donation through the town, so we can continue the program, buy things for the kids, and help support these trips that they go on, and try to build support, in collaboration with the kids, so they understand that they have somebody that they can go to and they can trust. And
Sure.
that's really, we want to make sure they know how to make good decisions and they're getting that message, because some kids at home aren't getting that message, and we're hoping we can help those kids.
Is it safe to say, in regards to the DARE program, I know we're 6th and 7th graders, and we want to start reaching out even to a younger age, because that's when they actually do start making these decisions as they're getting into middle school. But a thing that bothered me a few weeks ago when we were having this discussion is it stops at 6th and 7th grade. We really do need to continue the education into the high school level. So is it an accurate statement to say that if we were able to get more donations from the community or from businesses, that we would be able to start implementing the younger age as well as the older age?
Oh, without a doubt. Our two DARE officers we have, Sergeant Kamick and Officer Woodworth, they're very committed to the program. The SRO, Joe Perna, he's very committed to these types of programs too, and if we can expand it, we're obviously more than willing to do that. We want to reach out, we want to build those relationships with the students in town, so as they become adults, they know, hey, I remember him from back when I was in school.
Sure.
I can go to him and get help.
I think that when the commissioner spoke to us in an earlier episode, she made it clear that we need to start educating not only the parents, but the kids at a younger age,
Yeah.
so that they truly understand the ramifications of the opioid crisis. And I think it's important now more than ever that maybe we start reaching out to the community to try and see if we can't raise those private funds. I wish I could tell you at the state level that we can put those dollars back. I can't, because we're still going through economic problems. So it's going to take the community, I think, together, partnering with the police station. Would somebody reach out to the police station if they wanted to make a donation to the DARE program?
They can call and speak with Sergeant Kamick, and he can guide them in the right direction on how to, if it's a community group or an individual, he can guide them on how to make that happen.
I think it's so important. I've seen what good comes out of those programs, but like you said, it's just a 6th and 7th grade. We need to do it at the lower levels, and we need to do it at the higher levels. And I think we need to reach out again to the community, see what we can do to raise the funds so that we can start doing that, because education, I'm starting to hear over and over, is the key to helping these folks not get addicted, the prevention piece of this.
And I also think not only is it the education, but I think it's also the relationships that they build. If you know you have a friend or a relative, maybe one of their parents, has a problem, who do you turn to, especially as a kid?
Yeah.
If they know they have a relationship with a police officer, they can go talk to them and try to work through this. We can help them. We're not going to go to the house and arrest their parents if they tell us they have a problem. We're going to try to get them help.
Sure.
And that's really what we want. The message we want to get out there is, we want to build these relationships so the kids understand the dangers. They understand how to make good life decisions, but they also understand that they have a friend. They have somebody that's here to help them. We're not here to hurt them. We're here to help them. We want to make sure the community's safe and everybody's healthy, and like I said, somebody who gets cured from this disease is a productive member of society, and that helps everybody.
Sure. I mean, one of my goals to having this addiction episode is to let people know, and we talked about this with the commissioner in the last episode, is there shouldn't be a stigma attached to this. This is a disease. A lot of folks are going through it. Don't be afraid to reach out to the police officers and to others for help, because there's a lot of help available to people. So, okay, we talked about DARE, and I'm taking up your time. What else are we doing here in Ipswich?
Well, the other thing, we have an officer, one of our detectives is assigned to the Drug Enforcement Task Force, which is a regional, statewide, New England-wide task force for the DEA. And, this is more an enforcement side, not and that is part of the program. You have to have some enforcement, and, these drugs aren't starting in Ipswich. They're coming here from somewhere, and he works in the regional task force, and they've made a lot of good arrests with some big time drug dealers trying to move their products around this area, the whole North Shore. And it's a very good program. I can't get too much into detail about what he does, obviously, but it helps the community a lot because he's stopping the flow. You can't stop the flow completely. It's never going to happen. That's why we need to have these other programs too, but that's a big component of what we do. And a lot of people don't necessarily see the work he does because a lot of it happens outside of Ipswich. But I can tell you right now, the people that he's dealing with, when he's dealing with them outside of Ipswich, those are the same people that come to Ipswich. So if the arrests aren't being made actually in town, it is the same people.
And within the past year, I've seen in the newspaper where there's been 2 major arrests of dealers who are dealing these drugs here in Ipswich, and they have been prosecuted, and if I'm not mistaken, have now been incarcerated.
Yep.
So we understand that is going on. I think that's part of the frustration, and you just mentioned it. People aren't seeing it.
Yeah.
You know, obviously it is being done behind the scenes. Investigations are going on. We do understand in some cases who the drug dealers are, but it takes a lot of work and a lot of partnerships between all of the public safety officials for an arrest to actually happen. You have to get evidence and things of that sort, and it doesn't happen overnight. And I think people are frustrated. You've already mentioned in your statistics some of the deaths that have taken place in Ipswich. And those don't only hurt the family members, but it hurts the community at large. And so people get very frustrated and say, what are we doing in regards to the drug dealers and the dealings that are happening here in Ipswich? People need to know, and I hope you can emphatically tell us that, yes, we are working on not only the prevention side, but going after these drug dealers with everything you have.
We want to arrest drug dealers. That's what we want to do. We don't want to arrest people that have a problem. We want to arrest the drug dealers because they're the ones who are helping the problem continue, you know. And, you know, as part of that, if someone has a problem, if someone's watching this that has a problem, you know, they can come down to the police station and tell us, hey, I got a problem. We'll try to get them help. We'll find them some help somewhere, you know, whether that's through the hospital or through a court, you know, through the court system. And, you know, that's the thing I'd like to talk about right now, too, is people need to understand that they can come to us if they have a family member or they have a relative that's having a problem with substance abuse. It doesn't just have to be opioids. It could be alcohol or any other type of substance. If they have a substance abuse problem, they can come to us and we can do a thing called the Section 35. You know, Section 35 is basically the family petitions the court to get help for the person because they realize that the person has an addiction that they can't get over. People can't get over these things by themselves, and if they're not going to go into treatment voluntarily, a family member, a relative, or even a police officer, we deal with people sometimes over and over again, and then we can say, hey, look, we have a clear pattern that this person has a problem. So then we can ask the court to involuntarily commit that person to get them mandatory help. Obviously, does that work all the time? No, because the best time to get someone help is when they want help and they want to change their life. But sometimes to keep them alive and to keep them going, you need to involuntarily commit them. And that they can go in for the court-ordered amount of time, and if they come out and they relapse, we can put them back in. And I think people don't want to do that necessarily all the time because they think it creates a stigma. But it's not an arrest record. It doesn't go on their permanent record. It's just a way for us to, it's a tool for us to use and for family members to use. And we're happy to walk people through that process. We love when people come into us and say, my family member has an addiction problem, we need to get help. And we're more than happy to walk them through the process, take them up to the court, show them how the Section 35 process works, and then we'll go get them and get them some help.
So I think people need to be clear. You're not being arrested by doing this.
Well, you know, and that's the thing. If we get a Section 35 on somebody, like say somebody came in and said, hey, my family member's hooked on opioids or alcohol. If we can't get them to come voluntarily, the court will issue a warrant of apprehension. It's not an arrest warrant, but it just allows us to be able to go and forcefully take them out of their homes. They have to be handcuffed because that's the policy. You have to handcuff somebody when you're transporting them. And then they take them right up to court. That's it. There's no record that they were arrested. It's not an arrest. It's a warrant of apprehension so they can get before the judge. If they won't come in and see the judge voluntarily, then we have to go get them to bring them before the judge. And then the judge will look at the facts from the family. They'll list all the different reasons why the family believes this person has a problem or the reasons why we believe the person has a problem. And then the judge will make a determination and they'll send them off to a treatment program. They don't put them in jail. They put them in a treatment program where they can get help, where they can detox and try to turn their lives around. And, you know, sometimes it takes people 2 or 3 times to get involuntarily put in. Sure. But it works, you know, and we don't want to see people dying. If, you know, I can't tell you, I have 8, like I said, I have 8 deaths in the last couple of years. I can't tell you how many people out of those 8, people came up to me and said, oh, geez, I knew they had a problem with pills, but I didn't think it was a big deal. Well, it is a big deal. If you know somebody has a problem with pills, their next step is heroin because they run out of money because the pills are very expensive and the heroin's sometimes half or 2/3 cheaper than the pills. So when you run out of money and you're still addicted, where do you go? You go to the cheaper option.
And that's...
People that have a problem with pills is not okay. Just because they're prescription pills, you're using them improperly, that's not okay. And if you know somebody that has that problem, they need to get help.
And again, there's no stigma, or shouldn't be a stigma attached with going to a police department and asking for help in the court system. All we're doing is getting them into the courts and getting help from other programs that are available to the court system.
Yeah,
And I think
they're
people
not
need to be
becoming
clear about
exactly. They're not becoming they're not going into the court as a criminal. They're going into the court as somebody who needs help, and they're going to a hospital. They're not going to a jail. They're going to a hospital to get help.
that. And again, they're not the only ones in this situation. No. They need to understand that.
And I think the commissioner was very right on the money when it says, listen, if you have diabetes and you see the symptoms, you're going to go to the doctor. Well, these people, they know they might not even know they have symptoms, or they know they have the symptoms, but they can't get that. They can't bring themselves to ask for help. But if you had a family member that you knew was sick, you would encourage them to go to the doctor. You'd probably even take them to the doctor if they were sick. But with this scenario, with the people, I just knew they had a problem with pills. I didn't think it was a big deal. Well, no, you know that at this point, people should start thinking, this person needs to go to the hospital. They need to go to a doctor. And if they won't go on their own, I'm going to do something and make
And
them
don't
go.
be afraid to do it.
Don't be afraid to do it.
Don't be afraid. Don't
Make
be
it happen.
scared. We're there to help you.
The people might not be happy with you because you made them go to the hospital, but you know what? You might have saved their life.
Yeah.
You know, and I'll tell you, like I said, a couple of these deaths, we've gone on calls, and they've refused treatment. We've tried to get them treatment, and some of them, it's sad because you see it, and then all of a sudden, you know where you know what road it's going down.
Wow.
It always ends up in a bad place. So we want people, if people can't help themselves, their family members need to get them help, and we're here to help them get the help. That's
Beautiful.
what we're here for.
Well, I can't thank you enough for taking a few minutes out of your day to come and talk about this issue. It's not an issue people like to talk about, but it's something that you and I need to do for our communities to get the information out, let them know that there is help. So, Lieutenant Hubbard,
thank you this. It's great.
For coming down. We're going to take another break, and when we come back, we're going to hear from our police chief over in the city of Gloucester. So we'll be right back.
Liz was fun and smart and beautiful.
She graduated 10th in her class. She was on the National Honor Society. She was a cheerleader.
She liked to experiment with drugs. She wanted to know how that felt, and she never had any idea what that would bring into her life.
She started with some pills, and she liked it because she was, at least she later told me that she felt self-conscious and she had low self-esteem, which I was shocked at.
She got addicted to it physically and emotionally.
And before I knew it, she wiped out her bank account. Her friends changed. She got a little violent at home at times. She was a different person. There was something wrong.
It was expensive. So then the next logical thing was, if you're addicted to that drug, is to turn to the cheaper option, which is heroin.
It was hard as a mom to say, or even think about the fact that she was doing drugs, because I had the drug talk with my daughter. She knew the dangers of drugs. What I didn't know was the addictiveness of drugs out there. I did not know about opioids, and I was in denial. My kid would not do that. I knew she would not do that.
There's a leap from trying something to being a full-blown drug addict, but I don't think that most people realize how short that leap really is.
She stole money from me. She stole money from friends.
She turned into a master manipulator.
They just want that drug because that drug owns them.
We just couldn't even approach Liz because we knew what her response would be, so that's when we went to court and had her sectioned.
I petitioned the court to put her into jail because she was safe and I knew she wasn't doing drugs. It was a nightmare. It's a nightmare for parents to go through this.
Her biggest regret was that first time. I think once you start on that path, it takes serious commitment and strength, and even people that have those things still might not make it. It's an uphill battle every day, and it's every day for the rest of your life.
Welcome back to A View from the Hill. As you know, we've been talking about opiate addiction on the last episode and in this episode, and I'm so pleased that we have this special guest from Gloucester, Chief Campnello. Thank you for joining us today and talking about this issue. I'm going to read from a New York Times article, which amazes me that this went national, what's going on in Gloucester. What we've been talking about with the Commissioner Burrell and Lieutenant Hubbard in the last segment about the opiate addiction is, what can we do to get people some help? We had a lot of stats that we were given from the commissioner at the state level and the deaths that have occurred on the North Shore, from Lieutenant Hubbard. And we're all trying to get the message out to people that, yes, it's an addiction, but it's not something that we need to be ashamed of, that there's a lot of help out there for people. And you understood that very clear. A few months ago, I think it was, you created this great program over in Gloucester that, again, not only got North Shore news, got Commonwealth news, but spread out to the national news. So I'm just going to read these first couple of paragraphs, and then I want you to jump in and explain what happened. So from the Associated Press and the New York Times, the young woman nursing a fresh black eye has come to the police station in the old fishing city for help. But she's not looking to report a crime or seek someone's arrest. She wants help kicking her heroin addiction. It was better than the alternative, says the woman in her mid-20s, as she waits wearily for her ride to a detox center, following a long night that involved a stint in the emergency room, wrestling with the early pains of withdrawal, and finally sleep in a police holding cell. I just knew if I was let go, I'd just go out and use. So the chief has taken a novel approach to the war on drugs, making the police station a first stop for addicts on the road to recovery. Can you explain to the viewership what you have done in Gloucester? We know there's a heroin problem, not just in Gloucester, but across Cape Ann and across the North Shore. You took the bull by the horns and you created this program. Can you tell us about it?
Right. I think first, probably viewers are interested in this particular woman. We remember her very well. She is doing great. She's about 80 days clean and sober now. We talk at least once a week. She was, to give an idea of the stigmatization of this disease, she was a CPA in another state, which, as you know, a CPA exam is probably the hardest exam besides the boards for being a lawyer or some other of the professional exams that are out there. She had a family. She owned her own house. She was doing great. She got caught up in this through a prescription issue and ended up on the streets. And luckily, we were able to place her, and she's been doing really well. So we're happy about that. So that's one story out of many. What we decided in Gloucester, we had 4 deaths in the first quarter of the year. And to us, that was 4 deaths too many, as any community, I think, would agree. And we decided from the police perspective to take a proactive approach from the demand side as opposed to the supply side. We're historically very good at addressing the supply side of addiction, meaning going after drug dealers and seizing their assets and using them for addiction and recovery and things like that. We felt that by launching this program, we could also attack from the demand side and hopefully not only improve individuals' lives, their families' lives, but the quality of life for the citizens we serve. So our program consists basically of if you're addicted to drugs and you present at the police station with the remainder of your drugs or paraphernalia and you ask us for help, we flat out refuse to arrest you or charge you with a crime. Instead, we will fast track you into an appropriate care system and follow you through that care system to make sure that you're on the right path. We understand that relapse is part of this disease, so we offer the program over and over and over. And what we like to say is, once you've entered the Gloucester Initiative program, you've entered the first day of the last recovery you'll ever go through. No matter what happens to you, the police department's going to be there for 1,000 years. We also pair that individual with what we call an angel, who is a member of the community. Could be a recovered addict themselves, someone who's lost a family member or has a family member in crisis, or simply a person from the community who wants to help out. And we keep it very simplistic. As if you can hold someone's hand, if you can talk to someone, if you can listen, you can be an angel. It's all in a very monitored situation at the police department, so we don't need a recovery coach, we don't need an advocate. There's nothing left to chance, so to speak, and we just need someone to be there for that addict. We know that they're 10 times more likely to stay and wait for treatment if they have that support system. We also decided that the price gouging that had been occurring with the nasal Narcan was borderline criminal. In Gloucester, we were finding that people with insurance could get Narcan for $3 a dose. People without insurance were paying $140 a dose. We stated that the police department would pay for that for people who couldn't afford it out of our federal and state seizure money, which is money adjudicated to municipalities as a result of judgments against drug dealers in court after they've been arrested. So we use that money to pay for Narcan, and it's a program that's worked well. It's actually reduced the price of Narcan. Attorney General Healy has just settled with a pharmaceutical for $325,000 for this very issue. That should keep the price level and affordable. So we think that's a great stride in that particular part of our program. And the third was that we were going to talk to people like you in the legislature and see what we could do about earmarking some of those state funds that were received specifically for addiction and recovery.
And I think it actually, Baker administration, again, the commissioner was in earlier in talking to us about this issue, and I think there's a great partnership because we all understand the issue and how big it is and how harsh it can be on families. So I, for one, and I know many of my colleagues are willing to stand up and redirect, if you will, some of those dollars back to this crisis, if you will. More than ever, we're seeing it in all of our communities. It's just not a Cape Ann issue, it's not a North Shore issue, it's a Commonwealth issue, and as we heard today, it's a nation issue, national issue. Help us understand, other than this great program that has worked so successfully, tell us some of the, you've told us the pros of it. Have there been any cons to it?
We continuously and daily identify barriers to treatment. We don't want to be in the healthcare system. We're police officers. But after this program caught a lot of fire, after our Facebook posts started getting millions of hits, being shared throughout the country and in 61 other countries, we felt very responsible for the message. So we dug ourselves into the conversation more and identified barriers that have to do with treatment providers, insurance companies, pharmaceuticals. So the cons have been overcoming those barriers, but we're finding most of them come from communication disconnects between those entities. And we find by bringing the voice of law enforcement in as kind of a detached third-party voice, asking questions, that we can sometimes make reconnections. And in some cases, it's as simple as that. We've been able to place in about 100 days 160 people, actually as of today, 164 people into treatment with about $5,000 in costs out of our seizure account. No cost to the taxpayer. There are beds everywhere, despite what people say. And I think the idea of law enforcement entering the conversation from a conservative standpoint, but entering on a social level, has brought out some of these overturned some stones in which light hadn't been shown before.
Now, obviously there's a cost to this program, so how's it being funded?
Well, the cost for us is very minimal, and we fund it, as I was saying, out of the assets we seize from drug dealers. It goes right into helping addiction and recovery. So, and we've spent, as I said, under $5,000 from that particular fund for 160 people into treatment.
And you said partnering with insurance companies and things of that sort, the cost will then be taken care of, or
we're finding that there's plenty of funding out there, that we're getting confusion from the providers and the insurance companies as to how that money is to be spent. For instance, we talked to a provider who says, well, the insurance company won't let us do that. We talk to the insurance company says they better be doing that, we're paying them to do that. And there's a disconnect. But when you're talking to both sides and getting both sides of the story from a third party, whether it be police or anyone else, you can make those connections again and get rid of that barrier. So the cost of treatment is going to be something that, if this program sustains and develops throughout the country, that's going to be something that's going to have to be looked at. We feel that there's a real connection between the cost of incarceration in the cost of treatment. The figures that I've been told is that for every dollar we spend in treatment, we spend $7 to incarcerate someone. So if we can funnel some of that money into treatment, then I think we'll do okay. We're not going to bankrupt anybody.
Well, my eyes were opened in that regard about 2 or 3 years ago when we were doing the Melissa's bill, and we had repeat offenders that were coming back and committing crime after crime. Well, we did have a discussion about opiate addiction and drug addiction, and what I was seeing and hearing is just what you just said. The cost of incarceration as compared to getting care was astronomical. And I look at what has been done in Florida. I look at what's been done in Texas, which would be perceived to be very conservative states in regards to crime. They have totally gone the other way and try and get treatment for people because it does cost less than incarceration, but at the same time, obviously, they're getting the help that they so sorely deserve. Another issue that I heard, and we're trying to work all this out, it starts as a Gloucester program at the Gloucester Police Department. Is it only for Gloucester residents, or are you seeing that others who have addiction are coming in from other either towns or even states?
So we started it specifically for Gloucester, and as a result of the community's wishes for what they wanted their police department to do in this regard. Luckily, very fortunately, we had immediate interest from centers across the United States, and immediate interest from police departments across the United States. And we've been able to partner with about 45 treatment centers across the United States who've offered us scholarships for people that don't have insurance or for people from out of state who present. We've helped anyone who wants help in Gloucester. They're never turned away, and we have not turned away anybody who's come to us from anywhere. You know, I live in Ipswich. We've had Ipswich people who've gone into the program. We've helped them. We've had them from as close as Gloucester to as far away as Southern California. The out-of-state ones are more difficult for us if they present. Oftentimes now, because we have such a network of centers, if they call us, we're able to facilitate treatment. And you're talking about a small police department in a small city that's able to do this. So, you know, the fact that we've changed our historical thinking and our historical processing of people with addiction, we feel that we can stand up and expect that from the entities who are supposed to be taking care of this issue. And we feel that we can identify, you know, funding sources so no one goes out of business, improve quality of life for people who aren't involved in this at all, and reduce the stigma associated with addiction because it's not a crime, it's a disease. We know that, it's been medically proven, and it's about time we started handling it.
So how is this different from the program that exists in the court system where we heard from Lieutenant Hubbard that if someone comes into the Ipswich Police Department, a family member who they feel is in need of some help, but aren't willing to help, that they would go and not arrest them, but get them into custody and then bring them to the court system, and then the court system helps them with these programs as well. I think he called it Section 35.
Yeah.
How is that different from this, other than the step of going to a court instead of just the police department?
So this presents like a disease in every way. If for instance, if you had someone with a debilitating long-term disease and they didn't want help, they're not going to get help. You can't force that person to get help. It's the same with addiction. We feel that any coercion, any force negates the possibility that they may do really well in a program. So we have taken away any threat of a crime, any threat of being involuntarily committed, any threat of coercion through solicitation of information or anything like that. And we have simply said, if you're ready for help, we're ready to help you. And you can keep coming back as long as you want the help. And we think that that's the best kind of variable set for success. So the other programs that are out there, and don't get me wrong, there are some people who, because mental illness and addiction sometimes go hand in hand, that can't make decisions for themselves and need their family members or the police to step in with Section 35s and get them into a court where the court can get them treatment. But we feel that in the majority of cases, if a person is not ready for help with their addiction, nothing is going to get them to receive help. So we simply want to be there as a safe haven for those who are ready for help.
Any other programs in Gloucester that you want to speak to in regards to the opiate addiction, other than this particular one?
Well, what we found is that this was specifically designed to address the epidemic proportions of what's already going on. But we're getting great feedback about prevention programs that we plan on instituting, hopefully by this time next year. From my perspective in law enforcement, and I don't know if it's a commonly shared idea. I know that the program is still being used, but DARE historically has not been too successful in reducing recidivism or reducing first-time usage. How do we know that? Well, in the last 20 years, the price of heroin has gone down, availability has gone up, usage has gone up, addiction has gone up, and death has gone up. So we're exploring different ways to approach prevention holistically, not only from a police perspective, but from a community perspective as well. So we're working on that as a result of this program.
Very good. The problem itself, which has grown, and we've heard now from the Commissioner, Lieutenant Hubbard, and you've just said it, the deaths have grown, the addictions have grown. Have other police departments, because they're obviously going through the same thing that you went through and going through, have they reached out to you to see how they can put similar programs into place? Because on paper, it looks like it's a very successful program, and it seems to be working. And you've already talked about the woman that you helped, that this article addresses. Are other police stations or other public safety officials reaching out and trying to do similar programs?
We're getting inundated from across the United States by police departments who are interested in implementing what would work for their community. We don't pretend or impose that the Gloucester program would work in any other community, or any community for that matter, that wishes to enter the debate on the demand side of the issue. But there are 1,000 different ways to address this in an unhistoric fashion from the police perspective. And we welcome those to come into a conversation with us about how we can band together in law enforcement to address it from a demand side. So we have probably 20 police department partners as far away as Illinois and as close as Methuen and Arlington and Andover. And we have another 30 that are discussing it. Cities of considerable size: Orlando, Florida; Worcester, Massachusetts; Winnipeg, Canada, wants to adopt some sort of program associated with this model. And we see a partnership being developed that we can facilitate under our national nonprofit that we created, which is PARI, the Police Assisted Addiction Recovery Initiative. It's actually PAARIUSA.org. And we invite police departments to come there to get free model policies, free access to all the partners that we have in law enforcement and in treatment providers, and to continue the conversation until we can work our way out of this epidemic.
So thank you for that information, and I want to thank you for coming in today. You've been great. I want to thank you for your initiative, and clearly I want to congratulate you because it's an initiative that's working very well, as I've said. And one of the reasons we put this program together and the program with the Commissioner is we want people to understand that there is help out there and not to be embarrassed to ask for that help. We're asking parents to be involved. If you recognize an issue going on with your child, you're not alone. There is help out there for you and your child. Do you want to speak to that issue a little bit before we close?
I think that the shift in thinking has to be dramatic, but it has to be universal, and it has to be that addiction is a disease. We shouldn't be, you wouldn't, you know, a lot of us, and I know this is very personal for you, a lot of us have been affected by cancer. If the only way to get help for your loved one who had cancer was to arrest them, this would be a pretty crazy country. We would never even think of that. And that's the thinking, the mentality that has to be applied to addiction. We know medically that it's a disease. We have to start treating it that way. We have to reduce not only the stigma that's created by society, and we think it by lending law enforcement's voice to the fact that addiction is a disease does a part in that, but also self-stigmatization. There's a lot of shame that goes along with this, and it needs to be brought into the open before we can fix it.
No, we agree. Well, thank you very much.
Pleasure.
And again,
Thank you, Representative.
congratulations on a job well done in the city of Gloucester, and as we're now starting to see blossoming out to the nation, which is great. I want to again thank all my guests for today's show, and I think we've had a great dialogue the last couple of episodes on this opiate crisis. I want you to know if there's any help or any assistance that our viewership has, you can reach out to your law enforcement. You can reach out to me as your state legislator. There is help out there, and we don't want you to be ashamed to ask for it. That's the message we're trying to get out to the public. You're not alone. There is help out there, and we're willing to help you if you want to reach out to us and ask for that help. So I appreciate you tuning in to A View from the Hill, and we look forward to seeing you in the next episode. Thank you.